Hello, assalamu alaikum. This is me, Dr. Jehangir, and you are watching me on my YouTube channel, that is Dr. Jehangir Khan. Well, today I'm going to discuss about the basic investigation to be done in in case of high blood pressure in any patient. So there are more videos on blood pressure. How do you diagnose high blood pressure? When will you say that this person is having high blood pressure and this person is having not high blood pressure? Regarding that, I have made another video. You can follow the link in my video in the description below. So briefly summarizing the diagnosis of hypertension, that is a single reading of 180 by 110. A single reading of 180 by 110, it is confirmed that this is hypertension. No need of further investigation or checking of blood pressure for the initiation of medication. This is actually the stimulus to start the medicine. 160 by 100 but with end organ damage. If this much reading is there of a patient and the patient is having end organ damage, this is indication to start the treatment right away. No need to waste the time on ambulatory BP monitoring or checking the BP twice a week or thrice a week. These two are clear. The problem is when the BP is less than 160 by 100. The problem is when the BP is less than 160 by 100 or less than 180 by 110 and no end organ damage. So the detailed video on this diagnosis of high blood pressure that is already made by me, you can watch it following the link in the description below. So if you are having hypertension or high blood pressure, what are the basic investigation you need to do? There are two types of investigation. One is the basic investigation, the other is extended investigation. Well, I will make another video on the extended investigation, but right now I will limit my discussion to the basic investigation. Now the first thing is ECG. In any hypertensive patient, if there is no previous ECG run, do it right away. Do it right away. The second basic investigation is the fasting sugar plus fasting lipid. Now this is the second basic investigation. This should be done in any case of hypertension. It will diagnose the hyperlipidemia or dyslipidemia, and it will diagnose whether the person is diabetic or not, because in most of the patient, in most of the hypertensive patient, there is concomitant diabetes as well. Number 3, serum electrolyte. This is the basic investigation you need to do in any hypertensive case. Serum electrolyte, that will tell you a lot. Serum electrolyte. The fourth thing you should do is RFTs. And the fifth thing is urinary. Now these are the 5 basics investigation you need to do in any case of hypertension. Now regarding the extended investigation, that is reserved for secondary hypertension, and that will make another video. I will make another video on that. Now the ECG can give you a clue regarding a left ventricular hypertrophy, or it can give you a clue regarding ischemic heart disease, whether there is previous hidden MI or not. The fasting sugar can diagnose diabetes, because in majority of the diabetic cases or the diabetic patients, they are asymptomatic. That is why these two are called the silent killer. The high blood pressure and the diabetes, they are called the silent killer. The fasting lipid, because the atherosclerosis, that is the hardening of the arteries, that is the basic pathogenesis in the diabetes as well as hypertension. You die because of what? Stroke. You die because of what? Heart attack. You die because of what? Renal failure. So what is the basic phenomena? The basic phenomena is actually the hardening of the arteries, and there is the blockage of this artery. This is actually the basic thing. So if you control the lipids, if you control the cholesterol, you can control actually all these mortalities. You can reduce the incidence of stroke, you can reduce the incidence of heart attack, you can reduce the incidence of renal failure just by controlling the lipids. Serum electrolyte can give you a clue regarding the Cone syndrome, or it can give you a clue whether there is a damage done to the kidneys or not. RFTs, again, it can be the cause or it can be the result of hypertension. It can be the cause or it can be the result of hypertension. Urinary, it can give you a clue regarding whether the kidneys are the main culprit of hypertension or the kidneys are damaged by hypertension. So these are the basic investigation, and based on this investigation you can extend your investigation, and regarding the extensive investigation I will make another video. Thank you for watching my video. Please press the bell icon to get the new notification of my video, and also share my video. Thank you.